Assalamu alaikum. Let's talk about pathophysiology of rheumatoid arthritis. Rheumatoid arthritis, in here there is hereditary predisposition and environmental triggers. So HE, hereditary predisposition and environmental triggers. These two causes activation of the CD4 positive T cell. These two risk factors like hereditary predisposition or environmental trigger causes activation of the CD4 positive T cell and thus release of the cytokine interleukin 1, TNF alpha, interferon gamma, and these three interleukin 1, TNF alpha, interferon gamma cause B cell activation, endothelial activation, and macrophage activation. B cell activation causes formation of the autoantibodies and thus immune complex formation and deposition, and which results in joint injury. Ultimately, they forms PANAS, destruction of the bone, cartilage, fibrosis, and ankylosis. And macrophage activation also release cytokine. Among these cytokine there are fibroblast, cytokine release from the fibroblast, chondrocyte, and the synovial cells. There is a release of the enzyme like collagenase, elastase, stromal-lysine, prostaglandin E2, and other enzyme, which results in PANAS formation. And endothelial cell activation causes recruitment of the leukocyte, and finally it causes PANAS formation, destruction of the bone, cartilage, fibrosis, and ankylosis. So in pathophysiology of the rheumatoid arthritis, there is hereditary predisposition, there is environmental factor, activation of the CD4 positive T cell which release cytokine interleukin 1, TNF alpha, interferon gamma, and thus it causes B cell activation, endothelial cell activation, and macrophage activation, B cell formation of autoantibody, and immune complex formation and deposition, joint injury, endothelial activation causing recruitment of the leukocyte, and macrophage activation release cytokines, and they also release collagenase, stromal-lysine, elastin enzyme, and ultimately it causes PANAS.